or the insulin which is available in India's, they can be divided into regular insulins or the premix insulins.
Okay.
So the regular insulins are the short acting insulins, or you can say the longer acting insulins, and we have the different class of insulin which are the premix insulins, which has a ratio of 30-70-50, in which we get a fixed combination of a regular insulin and a long acting insulin. So after that, after the research, and now since we after so much of research, now it is available in analog forms also. So now the better insulin, or we can say the ultra rapid acting insulin, short acting insulin, and the ultra long acting insulins are also available in the market.
Doctor, why do diabetologists say that, many people, actually many doctors actually say that pre-mixed insulins are not really good? You should have the flexibility to take as you want it.
Because diabetic treatment is actually an individualized treatment, because every individual is different. So we have a fixed combination. It doesn't apply to a fixed shirt size. Doesn't go for every way. That's why it is not that supposingly a patient who is a South Indian, his eating habits are different. A Maharashtrian person has a very different eating habits.
Yeah.
So we have to adjust the doses of insulin according to his food habits and according to his work pattern. So a fixed combination, we can't do any alteration because it's a fixed combination. So if you get that freedom, if you want that freedom, then you have to give it separately. So if you take it separately, then we can adjust the dose more thisly, and then secondly we can achieve a good HbA1c control if you have a
what
separate.
What is your magic figure, doctor, where you would insist on the HbA1c should be at a particular level?
I feel the target control is between 6.5 to 7. So if you achieve that target and you maintain it for a longer term, then you can prevent the long-term complication of diabetes.
But doctor, how many people actually manage to keep it at 6.5?
No, I feel 6.5 is though difficult, but somewhere around 7 we manage to keep. I know it is a little difficult for the patients to and for us also to manage that HbA1c target, but our goal should be to manage it. If you keep it more frequently, the visits should be more frequently, you should get a tighter blood control, you should be more vigilant with your diet, and then it is possible. It is not that it is not possible.
Especially with elderly patients, they often write to us about the challenges of managing diabetes.
Right.
It's because insulin can be kept constant, as the doctor has suggested, but the food intake, it also depends on your hunger level,
right.
all that. And you don't eat the same thing every day,
Sure.
so you will never be able to find out what is the glycemic levels of each food item.
Right.
Same way, if you may walk for 20 minutes and a 40-minute walk is so different from each other.
Right.
So that's why the challenge lies.
Right, and for secondly, the elderly patients, the adjustment of dosage is little more difficult because of, I feel the younger generation are little more aware and they are little more comfortable in adjusting the dosage also. The elderly people, I don't know, maybe because of age and all those factors, they are little more prone for hypoglycemia and hyperglycemic.
Exactly.
And so for them it is little difficult, but overall you can manage.
Doctor, before we go into hypoglycemia issues, analogs are newer insulins and they are supposed to be costly.
Right.
Now, another very favorite questions that people ask is, if we are going to pay more for analogs, what are the real benefits of it?
See, analogs, they are being devised because of they are being used because of the fact that if you use an analog, the chances of hypoglycemia or the chances of going into recurrent low sugars are little less. So the fluctuations in blood sugars are little less, and if the blood sugar fluctuation is less, then you can achieve a better HbA1c control. So analogs always have the benefit over the regular or the conventional insulin because they give you a better glycemic control. So
you mean to say that there will be less peaking of blood sugar?
Sure. And supposingly if you take a regular insulin, it will start acting after 20 minutes or so, but if you take an analog, it will if you take it before lunch, it will start acting in the next 10 minutes. So it usually matches with the meal pattern. So you get a better HbA1c control if you take an analog. So the glycemic control is better.
I see. And doctor, when it comes to hypoglycemia issues, elderly patients have the problem of nocturnal hypoglycemia.
Right.
So how does analogs help in that?
Yeah, nocturnal hypoglycemia is a common problem with elderly, and it can be definitely tackled with analogs, because normally the other insulins which are long acting, they usually have a peak time, and which is usually at the middle of the night. And if the patient is sleeping, we tend to patient tend to overcome that thing, and then they land up with nocturnal hypoglycemia. So the advantage with analogs which are longer acting or the ultra long acting, they don't have a peak, so they have a peakless action. So it maintains the blood sugar throughout the night, and there is less chances of hypoglycemia.
Okay, well, I'll ask you another interesting question. One, patient from the north, I guess he's in Gurgaon, he has asked one very interesting question, is that, beta cells are either partly or completely gone in type 2. So that's why there is no insulin.
Right.
But he says, why is that, when the doctor injects glucagon, his blood sugar can be brought back. Does that mean that the alpha cells also, along with beta cells, are damaged?
Sure. It's usually the alpha cells are also damaged over a period of time, and it's because of the alpha and beta cells, both glucagon and insulin, the ratio of both the things is, the little bit of damage is always there with the thing, and because of which the patients usually land up with hypoglycemia. If you have a good alpha cell which can secrete glucagon, then the chances of hypoglycemia are little less.
Doctor, do you also see that if you have fiber diet, then in type 2 elderly patients, they can almost reduce their drug dosage by 40%?
Sure, that is there. If you increase the fiber content in the diet, more of salads, more of green leafy vegetables, all those things, you can definitely in long run, or in fact we can see that there is little less of drugs which is required to control the hyperglycemia in that case. So
there
that plays an
older
important.
Gentleman from south who had written that when he has vegetable salads twice a day, not during meals, but between meals. In
right.
between meals, that means his food is constant.
Right.
It's not that the food is lesser. His meal is the same thing, but still he can completely skip the 8 units of insulin.
Yeah, definitely. That we can especially avoid, because if you eat more of fiber, there is little less of peaks, and if there are less of peaks, then there is less chances of landing with hyperglycemia or postprandial or in between hyperglycemic surges. So that is another important tip.
Okay. Doctor, quickly, what are the exercises that you recommend for type 2 diabetics?
I'm not in a favor of gym culture, so usually what I tell the patient is that don't go for any gymming or anything. Something which is you are comfortable, you love to do, may it be a dancing, swimming, regular walking, which you enjoy, you can do it on a regular basis, should be the exercise. Someone who don't like to go for a walking, they can go for some other form of exercise, but at least minimum 15 to 20 minutes.
Fantastic, because there was a recent report which said that you can actually go for functional exercises.
Right.
Functional exercises means without any machines.
Sure.
Now that could be walking on the road, it could be anything. Which does not have machines.
Small activities throughout the day, rather than going into a gym and doing an exercise at a stretch for half an hour, which will damage your proteins also. After that, sometime after burning the fat, it starts destroying your muscle mass also. So I don't suggest or don't recommend the patient to go for any gymming kind of thing. A regular physical activity, you should be active throughout the day. That is the more important thing in a diabetic.
The new trend is, doctor, in some of offices in Bangalore, they have stopped intercom.
Yeah.
You can only dial outside.
Sure.
For all the internal things, you need to actually walk across and talk.
That is the best thing.
One thing. Second thing, no sitting.
Everybody is standing. Yeah. This kind of things, you not to use lifts like somewhere where you can avoid lifts, or parking your car little more far from the place where you want to go, and that much of walking. These all small things make a big difference in your glycemic controls. So even if you incorporate all these things, you can, I think, control better.
Fantastic. 20 seconds, doctor. What is your message for diabetics, especially type 2 and GDM?
Okay. Eat healthy. Regular exercise will keep you fit, and you can avoid the long-term complication of diabetes. That is the basic thing for diabetics.
Eat regularly and exercise.
Yeah.
Thank you so much, doctor, for
Sure.
being with us.